So on page 95, table 6.1, we see a list of two categories of antiviral drugs that you can take if you have been exposed to the flu. Now, one or two of these may be really familiar and some you might not have heard of. The first category we have is a category called the neuraminidase inhibitors. So neuraminidase, of course, is an enzyme. And what these particular drugs do is to suppress that enzyme so that the virus cannot replicate. And the most commonly known version of the neuraminidase inhibitors is our prototype drug oseltamivir or Tamiflu. We've all heard of that. If it's taken within a couple days of influenza symptoms, it can suppress the symptoms and make the person get better quicker. However, it's got a lot of side effects. It can cause nausea. Being nauseated is probably the most common side effect, but it can cause bronchospasms, which can lead to shortness of breath. And one reason people worry about Tamiflu is because it can cross the blood-brain barrier and cause central nervous system side effects, especially in children. And horror stories have been told about children taking it and they just go out of their heads. And that's very scary for parents, of course. Tamiflu is also pretty expensive. And opinions are divided on whether it's worth taking or not. If I had a loved one who was immune suppressed, I would certainly want them to take that, but I don't know that I would give it to a child or to an otherwise healthy adult. That's something for the doctor to go over. Zanamivir or Relenza is also given for influenza. This is an inhalant drug. And on page 95, you can see the different nursing implications with these particular drugs. You want to check and make sure the person does not have a milk allergy, because milk proteins can be found in these particular kinds of drugs. The other type of drug that you'll find that can hopefully prevent an infection from starting in somebody who has been exposed are called uncoating inhibitors. And these work to destroy the viral coat and help prevent that infection from spreading. This is usually given to immune-compromised patients to prevent infection. One of the most commonly used uncoating inhibitors is a drug called amantadine. It's been around for quite a while and has been commonly used to stop the spread of influenza after somebody has been exposed to it. But amantadine has a lot of side effects, and it can worsen glaucoma. Notice this is in red. This is something the authors wanted you to know. Our prototype drug is a drug called Romantadine or Flumidine, and I always like to use this one because it's got the word flu in it, so it can make it a little bit easier to remember. However, you do have to read about the side and adverse effects of these particular drugs because there are quite a few. Let's talk about herpes. Herpes is a form of zoster virus. It's sort of kissing cousins, so to speak, of the chickenpox virus. And this can cause sores on the body and in the body. And this is just a picture of what we call a cold sore. And probably the vast majority of us have been exposed to some form of the herpes virus just from being around other people. They're very common. This is varicella zoster virus, which causes chickenpox, and this is what it looks like on the average chickenpox sufferer. Shingles, the zoster virus lives in nerve tracts. Once a person has had an active case of chickenpox, the virus never completely goes away. It just lies dormant. And it will usually pop up later in life or when a person has suffered some illness. It's said that about 1/3 of people who have had an active chickenpox infection in their early years will end up with shingles later on. It's very painful. This one you can see is in a real common area. It kind of starts at the rib cage and goes around to the back. It is supposed to hurt, sting, and itch all at the same time. Very, very uncomfortable. In severe cases, shingles can affect the eyes, and there have been cases of people going blind from shingles. So if you can avoid chickenpox by having the vaccine, which was not available when, it wasn't really available till the early to mid 90s. And so people who got chickenpox before that are a little bit more susceptible to getting shingles later. There is a shingles vaccine, but you have to have, there's certain criteria. You have to be a certain age and physical condition before your insurance will cover it. All right, so we do have some antiviral drugs for HSV infections caused by the herpes zoster. And the way that these drugs work is to form little fake molecules that fools the body into thinking, fools the immune system into thinking that it has run into the virus before. So it blocks the virus and all the virus enzymes from being able to make more genetic material. And a virus has little virus particles called virions that come out of the cell when the cell ruptures, and that allows it to occupy other cells and continue to replicate. And the antiviral herpes drugs prevent this from happening and control existing herpes simplex infections. And if you look on the bottom of page 95, viral DNA polymerase inhibitors, so they kind of fake the immune system out to stop the spread of herpes. Traditionally, there have been a couple different types of herpes. Herpes simplex 1 or HSV1, and that's responsible for the majority of the cold sores that we see. Usually kind of affect the mucous membranes around the mouth. Herpes simplex 2 or HSV2 is a more severe type that tends to, sorry, apparently we need to clean our computer, tends to be responsible for more genital herpes infections. And people can spread herpes when they have an active infection. And one of the big dangers of genital herpes is in a pregnant woman, if she has an active lesion, and sometimes it doesn't always show up on the inside, it will sometimes grow on the cervix or the inside of the vagina. And when that's the case, the fetus can be exposed to it during birth, and fetal herpes infections are devastating. They can be fatal, and they can go systemic, and there are pictures of it on the internet, and it is not pretty. But these two main viruses are responsible for genital herpes infections, and once a person is infected with herpes, the virus kind of hangs around. It'll lie dormant. A person can have one breakout and never have a breakout again, or sometimes they might notice they have breakouts in times of illness or stress. But there are a variety of medications that can take care of this, both external and in tablet form. And our prototype drug is a drug called Zovirax or acyclovir. We also have valacyclovir or Valtrex, and these medications might sound pretty familiar. They're pretty commonly used. These are very good drugs, but taken over a long period of time, they can cause damage to kidneys and bone marrow and can cause behavioral changes or CNS symptoms. And of course, we said milk allergy is a contraindication for the drug acyclovir. What these drugs do, like we said, is just to kind of fool the body into believing they've run into this before, and it inhibits the enzymes.